get this panel. Thank you guys so much for coming. So to introduce this panel and introduce the lovely medical students who agreed to talk to you guys today. So this panel is being co-hosted by two organizations, Icahn College and a medicine cabinet, sorry. So both of these organizations are geared towards ensuring that higher education is accessible for first generation and low income students. And a medicine cabinet also focuses on providing pre-medical advising to any students who are interested in attending allopathic or osteopathic medical schools in the US. So please, follow us on social media and visit our websites if you want to learn more about us and what services we offer. But let's get this panel started. So I'm going to just introduce Icahn College a little bit more. So Icahn College is a 501c3 Washington nonprofit. It was founded a few years ago by three high school students, who are very passionate about ensuring that the path to college is accessible for underserved and first generation students. So in order to do that, they've been offering help with personal statements, supplemental essays, and recently they've expanded into a pre-medical program, which is, how this panel is being hosted. So you can find out more information at icahn.college.org. And a medicine cabinet is also a recent company that was founded by three medical students, two medical students at Boston University School of Medicine and a medical student at Johns Hopkins School of Medicine. And this is created for pre-medical students specifically to help with their medical school application cycle. So for example, services offered include personal one-on-one counseling, as well as help writing a personal statement, drafting secondaries, holding mock interview sessions, as well as just general advice about prerequisites and how to get into medical school. So you can find out more information at amedicinecabinet.com and also follow both of these organizations on social media. I think we're all on Instagram, Twitter, and Facebook as well. So this is just more about our pre-med program, plugging it here. It's very easy to sign up, and we'll talk more about how we can help you guys later on today. So first off, we're going to start by having our lovely panelists, and I believe all four of them are on the call now. We're going to have them all introduce themselves, and then we can move on into talking about their personal path to medicine, as well as any challenges and mistakes that they face along the way, advice that they have for you guys in the application process and throughout your pre-med undergraduate years. And we'll also have time for a personal Q&A session at the end. So this whole panel should last until 8 p.m., but our Q&A session can last a little bit longer as long as the panelists are all free. And they will also be dropping their emails at the end of this panel if you guys want to reach out to them personally. So without any further ado, please meet your lovely panelists who are also wonderful, and three of them are third-year medical students currently on rotations. So it's really special that they took this time out of their very busy schedule to come and talk with us. So I hope you appreciate their time and ask them lots of questions in the chat, because I know they're very eager to talk to all of you guys. So we'll start with Sara. Sara, do you want to unmute and introduce yourself? And we'll just go down the line as shown on this slide.
Sure. Lovely to meet everybody virtually. My name is Sara. I am a third-year medical student at Boston University School of Medicine. I did my undergrad at the University of Washington and studied neuroscience there, and then went straight through to Boston University. And I'm on rotations at the moment. I'm in OB-GYN. And I love it so far. And I am pretty interested in health equity and mentorship throughout medicine. And I'm excited to answer any questions that you guys have.
Awesome, thank you. And I believe our second panelist, Enoch, might be unavailable at the moment, so we'll come back to him later. Cameron, if you want.
Oh, actually, I'm here, Lisa.
Oh, sorry. Do you want to go ahead?
Yeah, sure. I'm just driving home from surgery because I got out late, but I'm also a Boston University School of Medicine third-year medical student currently on rotations. Also was at the University of Washington studying neurobiology and English. My interests obviously include mentoring and health equity, as well as research. Just really excited to be able to talk with you guys and answer any questions you guys might have.
Awesome, thank you.
Very cool. Hi, everybody. I'm Cameron. I go to the University of Michigan Medical School. I went here for undergrad too. I'm actually in M2 because we do rotations during second year, but I'm also still on rotations. I'm in psych, enjoying it. And what else? Oh, I'm interested in medical education as well as like medical school administration down the line. I love to be around students and help out where I can. I'm so excited to be here.
Wonderful, thank you.
Hi, everyone. I'm Capriana. Thank you all for being here. I am a junior currently at the University of Puget Sound studying biology, and I'm triple minoring in Japanese, bioethics, and chemistry. I'm not in medical school yet. I got in through FlexMed at the Icahn School of Medicine at Mount Sinai, which is an early admissions program. And so I'll be starting after I matriculate in 2 years. But I'm one of the co-leads for the pre-med mentoring branch with Lisa, which has been really fun, and I see a lot of my mentees here, so thank you all for coming. And yeah, I'm looking forward to hearing all your questions, and hopefully we can get you guys some guidance.
Awesome, thank you guys for that wonderful introduction. And if you didn't catch all of that, no worries. We're going to be going more into their individual backgrounds a little bit more, just so they can share their experiences and also share any specific areas that they're really experts in, so you can ask them more about that. We'll circle back to Sara if you can just talk about any experiences listed here or not listed here that you want to talk about.
Yeah, so I did some work with the American Heart Association. I also did some cardiovascular research in a lab at the University of Washington when I was an undergrad, and did a lot of cardiac shadowing as well as transplant surgeon shadowing. So I'm very excited, and I love those opportunities, and I think they contributed a lot to the reason why I wanted to go into medicine, and also my journey in medicine. So I'm very excited to talk about those if anybody has any questions, and also specifically about going straight through from undergrad to medical school, if anybody has any questions about that as well.
Awesome, thank you. Enoch?
So I guess like out of the experiences here, like one of the most formative experiences for me includes working at a GI clinic. Actually, the thing I want to do the rest of my life when I grow up is to become a GI doctor. I think that one of the more important things in pre-med is getting more experience, specifically clinically, because the way that people practice may be very different than the way you think, especially because sometimes people think, oh, internal medicine, you're just going to talk to patients all day. But there's also procedures. And also in surgery, you think that, oh, I'm going to do surgery all day, but there's also a lot of clinic time. And so like that experience was really formative for me in terms of like what I want to do, what I want to do my research in, and basically my clinical interests.
Cool, and moving on to Cameron.
Yeah, so I did neuroscience, minor in business, couple experiences that were really formative, and like Enoch said, clinical experience is awesome. I did EMT during undergrad, and it was a big kind of formative experience to me thinking I want to do EM now, long term, and so that was a good first experience that I got during undergrad as well. I also did cardiology research. It was good experiencing clinical research. It doesn't all have to be kind of in the wet lab. You can do some research. Mine was reading patient charts, and that was like one of the things that Michigan Med School was really excited about. Otherwise, to have some leadership in some clubs, as well as some teaching for like undergraduate bio, and love doing those things. You can ask me about going straight through as well too. I stayed at the same school, or if you're at like a large university, I can answer some questions about getting opportunities there.
Awesome, thank you so much, Cameron. And go Blue.
Alrighty, so like I said, these are my majors and minors and whatnot. My biggest clinical experience was translating Spanish and Mandarin at a free clinic. which was near me in Tacoma. That was really, really great experience. And I would love to talk more about that if anyone has questions. Like I said, I'm currently a junior in undergrad, but I was admitted to FlexMed last cycle, which was this past summer. The way that FlexMed works, for those of you who don't know, is that you apply as a sophomore and then you get in early. One of the biggest draws is that you don't have to take the MCAT. So after you graduate your undergrad, then you matriculate in, you can take 1 or 2 gap years. So these are my stats. I think Lisa put these on here, so maybe that'll be helpful for you guys. You guys can ask me about FlexMed. I also applied to and got into other BSMD and BSDO programs, which is what you apply to right out of high school. You can ask me about clinical experience and translating, and also interviews, essays, volunteering, and whatnot.
Cool. Awesome. Okay, so we're going to move on to why you guys are really here, which is the panel. So the first question, and this is kind of pulled from like the collective questions that I got when I sent out the RSVP form. So how this is going to work is if you guys feel that another one of the mentors has already answered one question like sufficiently, you can then move on to the next question on this slide. But the general theme of this slide is the mentees want to know about how you went about choosing your career path in medicine, how you were motivated to start out on this journey, and how you decided on it in the first place. So with that being said, if any of the mentors want to take this, feel free to start. I don't think we need to go in a particular order. Just if you really want to answer this, go ahead.
I'm happy to start out. I think like one of the big things about deciding to do medicine is definitely experience, right? Because it's really difficult to know if you want to do something if you don't really know what that thing is. So like one of the big things that I always tell people is that most people, their experience as a doctor is going to their primary care office and then getting seen once a year, and then they might order some tests for, high blood pressure or like glucose or something like that. But the experience is so much broader than that, right? There's a lot of like research that goes on when you get your MD. There's a lot of other things to think about, such as patient charting and patient billing and whatnot. And so there are good parts and bad parts of the doctor experience that are very difficult to kind of grasp unless you have that experience within the clinic. So I think that's one of the big things. In fact, one of the other things that I also tell my mentees is to broaden your experiences outside of just medicine, because it's very easy to say that you want to be a pre-med and you want to be a doctor, but how do you know that's the only thing you want to do in life? So if you want to get a good idea of whether or not medicine is for you, importantly, you have to explore things outside of medicine as well. So maybe perhaps like computer science, English, arts, literature. And basically, I think the main thing about if you're wondering how you can get into medicine and wondering why, trying to find the reason behind why you want to do medicine, the best thing for you to do is to explore, and to explore broadly, not just inside the field of medicine itself.
Awesome. Thank you so much, Enoch. If any of the other mentors want to chime in here and talk about their experiences, please feel free to do so.
Dang, it's tough because Enoch answered it so well. I think I would only add, so I wanted to do engineering starting out. I didn't really think about medicine because no one in my family had gone into a medical path. And the real reason I wanted to do engineering was work on a team to solve problems. So once I boiled down what I really wanted out of a career, I thought about really my values, which were those things: work on a team to solve problems, but also have some time to be at home and have a family, because that's kind of my main priority in life. Once I boiled those things down, then I kind of thought about, hey, what's something that I could still do those things? And I'm working on a team, but I'm also working for people on that team. And that's kind of how I found the idea of medicine. And then I just kind of confirmed it through doing what Enoch said, getting experience, and everything I did along the way. I thought, wow, I actually could see myself in this position. It's not like Grey's Anatomy or Scrubs, but it's still pretty great.
Awesome. Sara or Capriana?
Can you guys hear me okay? I'm on my phone right now.
Yeah, we can.
Okay, sounds good. So I originally thought I wanted to do veterinary medicine, and I started working at a zoo and quickly realized that wasn't for me. And so then decided on just regular human medicine. And I think that really spoke to me because I didn't want a job that was sitting behind a desk all day, nor did I want something that I felt like I wasn't helping people. And so I think medicine has that tactile nature where you can see results and that you're able to interact with patients. And I think that really appealed to me. And obviously I'm not in rotations yet, so I don't know what I want to specialize in, but that, you know, aspect of you're really able to help people one-on-one. And I think that is really fulfilling for me.
Yeah, and just to quickly add, I mean, I thought I wanted to do something that involved a lot of service, because that was something that I was really focused on. And so I thought I was going to go maybe into another field of healthcare, whether that be nursing or something else. But I was exploring some of the different fields of healthcare and realized that I could really see myself in the job of a physician as opposed to other fields. And that's kind of what, when I kept thinking about which field I wanted, which career I wanted to go into, it kept coming back to my experiences when I was shadowing physician and seeing what they were doing and imagining myself in that position. So that was kind of how I landed on that decision.
Awesome. So it sounds like a lot of really important factors from shadowing to volunteering really influenced your guys' choosing of your career path, which is awesome. And we're going to talk more about that in the next slide. So this next theme is basically challenges. So a lot of mentees ask questions about the challenges that you guys faced in your path to get here. And then they also wanted to know what are some common mistakes that people make in their undergrad and high school years. And just want to put out a disclaimer that, you know, nothing is really a mistake per se. We're trying to go for like optimistic mindset. But what are some common mistakes that maybe you experienced in your undergrad or high school years? And can you tell us about them? And I think this time we can go in like order. So since I think Cameron, you were the first one to speak last time, do you want to go ahead and take this one? Oh, I think you was, but we can go with
yeah, so I guess I'll talk about the common mistakes one. I guess the only thing I can think of that would be like a mistake that you could make on this path is assuming that it's the only right path for you and picking experiences, picking opportunities that kind of check boxes along this path. I think the best approach you can take in trying to apply to medical school is really just doing things you enjoy. I think there are small boxes you have to check, like taking the pre-med classes and the MCAT. Not all of us are as lucky as the FlexMed program. But other than that, I think I have such a wide range of classmates who did so many amazing things in undergrad, whether it be like humanities majors or people who worked for a long time in like engineering or people who like worked on Wall Street because they enjoyed that. It's just amazing what kind of different perspectives they bring all together. And I think we would be at a loss if we were all like me and we all did science majors in undergrad and went straight through. So really, really do what you enjoy. Don't just focus on what you think med schools want to see, because I think med schools want to see you doing what you enjoy, which is kind of circular. It doesn't really make sense, but I hope you got the point of that.
I want to agree with Cameron. I think that is really true. I think especially like with the FlexMed program is really the only thing I can speak to. But during my interviews, they asked me about things that were not clinically related. They asked me about my quilt business or beekeeping. And those were things that I had not really expected them to ask me about. And so I think they really, more and more medical schools really want diverse and interesting physicians. And so I would definitely second that. And also, but that's not to say that your clinical experience and your research and whatnot is not important. And I think especially for FlexMed, if you're looking to do early admission or if you're looking to go straight in after undergrad, it's really important that you get involved right away. The more time that you're involved in things and the more things that you're exposed to, I think builds a stronger resume and just honestly looks better to medical schools. But lastly, the other thing I want to touch on for mistakes is that I think a lot of people assume that they have to go MD, DO, whatnot, but I think there's a lot of really great other options like PA and nursing and nurse practitioner and honestly DO also. I think not a lot of people know about DO schools. And so I think taking a step back and looking at all your options versus just MD can be really valuable to you and might fit what you're looking for better.
Yeah, I think one of the biggest challenges to my path was like some of the STEM classes can be quite dense and have a lot of material. So that was something that kind of almost made me question, especially like things like OChem really made me question if I was really skilled or like cut out to go into medicine and, you know, pursue a lifetime of studying science. And I think a lot of people put a lot of focus on their GPA and their MCAT and the more numbers focused game of getting into med school. And I think schools are actually shifting more away from looking at just your GPA and your MCAT. They're looking more at what everybody has mentioned, like their life experiences, their extracurriculars, what are you doing for fun, not necessarily even clinical experience, but while that is so important, like, you know, beekeeping and all these different hobbies that makes everybody unique. So I think one of the things that I wish I had done differently was focus less in the beginning on how I was doing in classes. While that's still very important, but you know, be able to establish that balance between studying and pursuing your hobbies, because once you get to med school, your time becomes even more limited. And it's important that you know how to balance what you do for fun and what you have to do to study early on, and that can start in undergrad.
Yeah,
I totally agree with what's been said so far. Oh, sorry, Lisa, I didn't mean to cut you off. One other thing that I would add is like Sara said, like definitely don't be afraid of failure, specifically like in the classes that you take, but also in extracurriculars, and don't be afraid of rejection, because I think that like it's easy to look at medical students and to look like at people who have been doctors and to think that, wow, they must be so good at what they do and they got into medical school because they got high GPAs and got good research. But the reality of it is that on the road there, you're going to fail at a lot of things. Like, for example, I emailed a lot of professors for research and a lot of them turned me down without even looking at, without even interviewing me or talking to me about anything. And there have been classes where I haven't done as well as I thought I should have done. And there are tons of things that I thought I would do very well, but when it came down to it, like I didn't get a favorable evaluation. I think that's very easy to think that that means that you're not cut out for it, or that you should be more careful in how you email people because you might get rejected. I think that in reality, a lot of people get rejected from things, a lot of people fail at things. And so the main way to learn about different opportunities and to learn from opportunities is to try and is to fail at those things specifically, because that's how you grow. So I think like one of the major things that people like starting out should keep in mind is to not be afraid of failing, to try different things and to be adventurous, to apply to things that you might not think you're qualified for, because sometimes those are the positions where you'll grow the most because you haven't been qualified to do it yet, but they'll teach you on the job, such as in the lab and whatnot. So I think like don't be so afraid of failing and try for more things.
Awesome. Thank you guys so much. And totally makes sense what you guys are saying about how everybody has their own path, and that failure is definitely not something that you guys should be afraid of, because even in medical school, you know, people fail all the time, and there's always going to be challenges, obstacles in your path. So having a growth mindset is super important. And I think there might be a question in the chat. Oh, yeah. Karen, thank you. All right, so gap years. So this was a big question that a lot of people had. What made you decide to take or not take a gap year? And I know Cameron and Sarah went straight through, and Capriana, I'm not sure if you're going straight through, but I know Enoch, you took a gap year. So if you guys want to just talk about why or why not you decided to take a gap year, that would be awesome.
I can start. So FlexMed allows you to take 1 or 2, even more gap years if you want to. You just have to tell them ahead of time. And so that's definitely something that I'm considering. Recently, I'm not going to lie to you guys, like ever since getting in, before that, I was really focused on getting in. And now I'm like, oh crap, like I got to go to medical school. And it's kind of very daunting. And like, I've been talking to all of you guys about it, like Cameron and Enoch, and you guys are like, yeah, it's so hard. Like I gotta stay up till like, 3 a.m. And I'm like, oh crap. And so the gap year has been very tempting. And I really love to cook and bake on the side. And it's always been my dream to go to culinary school. And so another thing that I love is travel. And so I'm thinking about doing a gap year and just going to culinary school abroad for a year. And so that is just something that I'm thinking about doing, because if you have the availability and the flexibility to do that, I think that you should just take advantage of it, because once you're in medical school and beyond in your residency and as an attending, you're not going to have much time. And so I think, if you're not already accepted into medical school, taking a gap year might be a great, amount of time to expand your resume, but also take time for yourself. It doesn't have to be all about medical school. And so just doing the things that I love is the reason why I might be taking a gap year. So, but I'm sure Enoch can talk to why he actually has.
Oh, sorry. I think that taking a gap year has obviously the benefits and also disadvantages. Like disadvantages would be that you're going to take more time to finish your education and stuff like that. And also just you got to be smart in how you use your time, right? If you take a gap year and you don't do anything with it, then you've kind of wasted it. So I think that in terms of taking a gap year is a really personal decision. Like if you have things to do, like Cap was saying, then perhaps it's a really good decision. If you need to work to bolster your application, that's a really good reason to take a gap year. A lot of pre-med, all of the stuff to get together, all of the volunteering, all of the research, all of the everything, it's a lot to do during 4 years. And so if it's really demanding and it's challenging your mental health, I think it's a really good reason to take a gap year. For myself, the reason why I took a gap year was because I thought that I was burnt out by the end of undergrad. I worked very hard, I did a lot of things, and I just wanted a break. So I decided I'm going to get more clinical experience, kind of learn more about the field itself. And in the meantime, I'll just work on myself and work on doing things that I really enjoy. And so that's one of the reasons why I took a gap year. But I think overall, it's a really personal decision. There's no right or wrong answer. You definitely go through life a little bit slower if you take a gap year. But at the same time, if you feel like you need that break or you feel like you need that time to become the best medical student you can be, then I think it's a very appropriate thing to do.
For me, I had already taken, I took a major, and then I took 2 majors, and then I took a minor. And with the amount of credits that you had to take to complete both those degrees, I was already going to kind of extend my schooling a little bit into a little bit past the traditional 4 years. So it's almost going to be 4.5 years. So in a way I did have to, in a way I did take a gap year. Just half of it was classes. But I had also intended not to take a gap year if I could, just because I wanted to kind of just dive right in. And I was excited about getting into medical school and starting to actually learn medicine and work with the human body and all this other stuff, and kind of pursue what I had always been going for. And looking back, I think I could have taken the year a little bit more relaxed. And I think a gap year would have been a great addition if I had chosen to take a gap year, or if I had taken a gap year. I don't regret not taking a gap year, because I also really enjoy just being able to go straight from undergrad to medical school, and kind of I had the like the study skills, and I was accustomed to tests and all this other stuff. So I didn't feel like it was too much of a disconnect between kind of work life and then jumping right back into schooling and whatnot. But I think both options, again, are great options. And I think it's just mostly based off your personal circumstance and how you feel in that moment about, do I want to take a break, and do I feel like I'd really benefit from one?
Yeah, now I'm thinking I didn't take a gap year because I'm just not as cool as the people who have awesome hobbies like baking and culinary. Like, I didn't have anything that cool that I wanted to do. No, but like seriously, I think it is really dependent, like Sarah just said, on like your own personal situation. I've heard arguments of, especially if you don't have the finances to kind of just take a year and like go to another school, or you want to work for that year and make money, and then that kind of builds up your finances as well too. I think that's a huge factor that people don't always touch on as much. I will also bring up that like I think it's like 10 to 15% of my class went straight through, so it's definitely a minority now. Just so you know, but I think if you feel ready and it's the thing you want to do, then why not go straight through? If you have other things you want to do more, then might as well do those things while you have a little bit of time in between. You can also get accepted and then usually defer. A lot of schools, Michigan included, usually overbook their classes, and sometimes they'll pay you to wait till the next class, which is very cool. Also, I just want to like say something about like the mindset of always looking forward to something. Like trying to get into med school, trying to graduate med school, trying to get through your residency. You can't think about like this path that way. I think that's a big part of what leads to burnout. So don't try to put off the things that you like for a long time until you're in attending. Because when you're attending, you're trying to get like the next job, you're trying to get your research out there, you're trying to like get a promotion. So really do the things you enjoy now, whether that's taking a gap year or finding the time to do it during like M1 year. Do those things now.
Awesome. Thank you guys so much. And Capriana, I want you to know that I'm rooting for you to go to culinary school. I think that's just such an awesome experience to have, especially abroad. Like if you go to France, you will learn from like the best pastry chefs in the nation. So that's awesome. Okay, so moving on to our next theme, which is the application process. So just to give a quick intro, the application process for most US allopathic and osteopathic medical schools is broken down into 3 segments. First is your primary, which consists of your personal statement and your activities, which is sent out to however many schools you want to apply to. The schools will then decide whether or not they want to move you to the next stage in the process, which is comprised of secondaries, which are basically like a set of maybe like 3 to 6 essay prompts that you fill out and then send to them. And then after going through your essay responses and any additional letters of recommendation you want to send them, schools will then decide whether or not to extend an interview invite to you. And if you do receive the interview, then you go through the whole interview process, and then you might wait for like maybe 3 or 6 months before they get back to you with a final decision on whether or not you were accepted, waitlisted, or rejected. So with that being said, and with that baseline, we would love to hear from you guys about when you applied to research, when you applied to medical school and what the application process was like for you. This can be like as general or as specific as you want. You can talk about how many schools you applied to. You can talk about, your experiences on the interview trail or your experiences writing secondaries, really whatever you guys feel most passionate about talking about. And we can start with Cameron again, if that's okay.
Yeah, for sure. So I applied my summer after my junior year. I think May is when you have to like have your application out there. I'll say, I guess for like in general for the application process, doing things early, as long as you don't sacrifice quality, is usually a good thing. Being on the top of that stack of a ton of people is not a bad thing at all. And I've just noticed that like all of the people I've talked to about applying to medical school, that people who applied earlier usually had like a generally more successful application processes. Other than that, I'll say like the interview process, make sure you are interviewing them as much as they're interviewing you, if not more. Really try to figure out if you could be happy in that space, if you could be happy at that school. If the med students around you could be your peers and you'd be happy to be friends with them. I think that's really, really important. But yeah, I'll leave it there.
I can speak a little bit about my application process. It was similar timeline to yours, Cameron, applying after my second to last year. And then, yeah, it's been, I remember I took, I think, that summer off because secondaries, it's like a lot of writing essays, and each school has like maybe 3 to 5 essays that they want you to write, and they're pretty intensive essays. They really like try to get your like deep feelings and reflections and whatnot. So you do have to spend quite a bit of a good amount of time on them. And, you know, they go through a wide variety of edits from different people, and everybody likes, you know, a certain style and whatnot. So that took me kind of all summer to write the secondaries and then send them out. And then that's kind of becomes a waiting game during fall quarter or whatnot, to see if you get any interviews. And then I was fortunate enough to get some interviews, including Boston University. I think I interviewed here in early January, and then I heard back in March or so, which is generally when you'll start hearing back, because March is kind of like when the deadline is for them to make their final decisions. And you can hear back earlier, as early as like October or something. But yeah, generally you'll find out where you are going to go in March. And then if you are on wait lists and whatnot, you can also find out later, like closer to the general like July start date of the medical schools. But overall, I would say like secondaries are probably the worst, just because they're a lot of writing. So I would definitely book a solid amount of time in your calendar to focus on those and make sure that they're polished and presentable and well done for the schools.
I definitely agree. Secondaries are pretty bad. There's just a lot of just sitting down and hammering them out because there's no like official like due date for secondaries. But if you kind of go online, you peruse around, people kind of think that 2 weeks is the amount of time you should let secondaries go before you respond to them. And each one of them, just like Sarah's saying, can be up to like 5 essays. The thing is that they don't just come like sequentially too. They don't just come like one like on July 14th and the next one in like August. They typically all come at like the same time. And so it's like definitely a mad rush to try to finish them. I think the one thing I would add is to think about your application really, really early. And so like if you're going to go to medical school, right? The question for you to ask yourself is, why am I going to be a doctor? Why am I putting myself through this kind of schooling? I think that's a really important question to ask, because essentially the application process asks you the same question. It literally asks like for a personal statement about why you want to be in medicine. And so I think that the medical school application is, like Cameron was saying, it's not to check off all the boxes saying you did all these things, but it should also be a reflection statement, right? To be, why am I doing the things I'm doing? How are my extracurriculars helping me become a better doctor, right? How are the things that I'm doing now going to make me a more well-rounded person, right? So like how my hobby is going to make me more well-rounded. How is my research going to enhance my knowledge of this certain field? How's my clinical experience going to allow me to speak in an enlightened way about why I want to be in medicine, why I want to participate in patient care and stuff like that. So I think in a sense that it's never too early to really think about the application, because the primary question application is asking is why you want to be a doctor.
So obviously my application process was a little bit different. For FlexMed, you apply as a sophomore in like your spring or like early in your spring semester in January. That's when it's due. And then a couple months later, they'll ask you to interview. And then a couple months later after that, they tell you if you get in. So it's a lot of waiting. Also, they want your second semester grades in. And so you don't find out until July between your sophomore year and your junior year. So for me, obviously, I didn't have to write secondaries, but the question of like, why medicine? Why do you want to be a doctor? Is really, really important to demonstrate not only in your application, but also in your interview. And so I think really thinking about that hard and then finding as many ways to implement that in your application and your interview is, I think, one of the best things that you can do when applying.
Awesome. Thank you guys all for talking about your experiences applying to medical school. And we're going to move on to another question, which is asking about advice on specific categories or sections of your application. So many people are curious about how important shadowing actually is. And shadowing, as you guys might know, is really difficult to get now with the COVID restrictions. So they can talk about that, as well as how important extracurriculars were, clinical experiences, like being an MA, CNA, or a patient tech, and as well as the importance being placed on MCAT and GPA, which I believe Sara talked a little bit about previously. So if any of you guys want to take one of these sections and maybe just talk about how you felt it was important, or maybe giving advice on people who are applying now or people who are thinking about applying, on how each of these factors might be relevant for their future hopes of becoming a physician.
Yeah, I can start out. I think like clinical experience is super, super important, because like if you look at the studies, like people often say like physicians have a high rate of depression, have a high rate of anxiety. They have, and some specialties have a high rate of job dissatisfaction. I think that one of the things is that it's not a very easy job to be a doctor, and you have to really want it to be it, right? Because you got to go through all this schooling, you got to go through all these tests, and if you don't enjoy that, then if you don't enjoy the job at the end, you're going to be burnt out, right? And there's also aspects of the job that people don't talk about, and they kind of suck. For example, like documentation. Like when I go see a patient in clinic, right, I spend maybe 15 minutes with them, and then I spend 10 minutes back in the office writing documentation, like what I said to them, what they said to me, the physical exam I've done, and whatnot, right? And the reality is if you ignore those things and you go into medicine and you really, really dislike it to the point where it makes your life miserable, then when you go into the medicine and become a doctor, those things aren't going to change. You're still going to have to write documentation. And if those things make you miserable, then you're going to be miserable, right? So I think that clinical experience is really, really important to help you figure out what kind of thing you want to enjoy doing, and if medicine is for you. And medicine doesn't have to be for you. So it's just really important to get experience and figure out what you want to do.
I would second that. One of the big things that I tell all my FlexMed mentees is that they want clinical experiences, like they want you to demonstrate that you have had them, that you've liked them, and that you want to continue them, right? That is the thing that you are going to be most exposed to as a doctor. You're not going to be, well, you are maybe shadowing other doctors in your residency, but you're not going to, they don't really care about your extracurriculars when you're a doctor. They don't care about your MCAT or your GPA. They care about your clinical experiences and whether or not you're good at it and you like it. And so I think that is most important. I would also say extracurriculars are very important. However, shadowing, like Lisa said, is very hard to obtain right now. I actually didn't have any shadowing when I applied, but I did have a lot of clinical experience. Something that I want to add to this list is like advocacy and community service, I think are both very important also. They want to see that you are going to be a patient advocate, that you are selfless and like working with the community. And so I would highlight those things for sure.
Yeah, I think those are great. I really enjoyed shadowing. I know it's difficult now, but I really enjoyed it for just being able to follow the physician around and see how quick he sees the patients. And then like Enoch mentioned, like how much he documents, how much he spends talking to nurses, coordinating care. Like there's a lot on the back end of things that I didn't realize before I had shadowed them, or like I didn't realize they would spend so much time talking to social work, or I didn't realize they went to case management rounds every single day. Like I think I had the idea that they just went to go see the patient and then they went to go see the next patient and whatnot. But there's a lot of like administrative work behind it that I think is important for people to know, and it's what admission committees want you to know before you go into medicine. And they don't want you to be surprised by how much other stuff there is. I think extracurriculars are super important. I think if there are things that you're interested in, it really reflects well on your application because you're able to talk about them with passion. And it's just something nice to see that for admission committees to see that you're a human. And then, like I mentioned, like I think MCAT and GPA, they're moving less towards using them in the whole like grading rubric or assessment of your application. I think some schools don't really look at them as much. Some schools use them only as like a threshold, a very low threshold. And then some schools still look at them a little bit, but it's really starting to more so focus on these the first three experiences versus the statistics that you're carrying as well.
Yeah, I guess I would just echo most of what everyone else said. I think most of these things you can fit into like a few different areas. I think shadowing, clinical experiences, all is just asking the question, do you know what it's like to be a doctor? I think MCAT, GPA, that kind of stuff is asking the question, can you succeed in med school? Like, can you actually do the learning? And I think as long as you're like, have a good amount, as long as you can answer those questions in the application, however you answer those questions, I think is fine. I don't think you necessarily need a great MCAT GPA if you went and got a post-bac and you like learned a lot in your post-bac and you showed that you can succeed in like medical school type classes. Same as like you don't need any shadowing if you have like worked as a nurse for 5 years or worked as a nurse at all probably. Yeah, I think it's just general questions you have to answer to an admissions committee, and however you want to answer those, I think is fine.
Awesome, thank you guys. And I believe Chrissy just asked a question in the chat about which approach worked for you in successfully finding a physician to shadow. And I am just going to add that this is easier at institutions that do have a medical center that's attached to them. So for example, the University of Washington has the University of Washington Medical Center. So I know there is a program through there called like the UWMC Observers Program, which lets you easily find a physician to shadow. But Cameron and Capriana, do you guys want to talk about your experiences finding shadowing at the University of Puget Sound and the University of Michigan?
Okay, so I said I didn't, I haven't shadowed anyone, but I will say that if you have any clinical experiences where you work directly with doctors, like I've had lots of like my coworkers ask all the physicians that we work with to shadow them. And so I think if you're able to join a club or you're able to volunteer at a hospital or a clinic and meet doctors that way, you can always ask if you can shadow them.
Yeah, I guess a few different points I'll make here. First, doesn't have to be a doctor. I would shadow anyone. I think even like learning more about what nurses, PAs, techs, everyone does, social workers do in the hospital, especially social workers. They do so many things. It's amazing. Knowing what they really do so that when you are a doctor, you can ask them for what they actually do and not the things that you think they do that are actually wrong is amazing. And you're also still getting experience in the hospital or in the clinic or wherever it might be. Other point I'll make is don't be afraid to like have someone not respond or say no to you. Just ask everyone. It doesn't hurt you to have someone say no. You still just have another opportunity to ask someone else. I would also say use like personal connections. I think some of the best shadowing experiences I've had were from like friends who have already had shadowing experiences, and I said, oh, like what is a doctor you shadowed? And that was probably the best ones I've talked to. Yeah, or through research, I think is another good way to find shadowing. If you happen to be doing research for someone, you can ask them or the people they work with. Really just kind of using all your possible opportunities is the best way to find as much and as valuable shadowing as possible. Don't just look for this one doctor in neurosurgery that you really want to shadow because you are thinking you want to do neurosurgery. Kind of look anywhere for shadowing.
Yeah, that's super great advice. Thank you so much, Cameron, and thank you, Capriana, for answering Simon's question in the chat. Okay, so moving on, we're almost at the end of the panel, and I want to give everybody some time to talk, to ask the panelists themselves some questions. So about the current school that you're at, or your current pre-med path for Capriana, what do you like about it? What do you dislike about it? If you had to change one thing about your career path up to this point, what would it be and why? So this is kind of an extension of us asking you, why did you pick your school, and what do you like about it? What would you want to change about it?
I can start out. I really like, one of the reasons that I chose BUSM was they are very dedicated to social justice, and they are one of the largest safety net hospitals in the area. And so we get the chance to see a lot of rare cases of a lot of rare like presentations of certain diseases, and we work closely with a lot of the social determinants of health. So like patients who are uninsured, patients who can't afford care, whose immigration status also plays a role in the amount in the care that they receive or are willing to seek out. And I really like how you get the chance to not only focus on the medicine part of it, but also on the social aspect of it, because there's a lot of factors that go into healthcare, even aside from of what's happening with the human body. So I liked that intersection between all of it. What I don't necessarily love about it is perhaps like sometimes it can feel like a big class. We have 160 people in our class, and then especially with COVID, it's been kind of hard to like see everybody and spend a lot of time connecting and bonding and everything. So I guess maybe, but maybe that's just me. So I'm not sure. And I honestly am blanking on kind of what I dislike about it. But if I had to change one thing about my career path so far, it would probably be to take more interesting like undergrad classes, because you only really get the chance to take some of those classes once, like a Scandinavian class or like a fish class or something like that. And if you don't get to take them, you get so busy later on in med school and in residency, and then you're attending, and life happens, and you never really get the chance to explore those interests that you might have had. So I think I would have loved to take some of those more like random classes that weren't at all associated with science or anything, and just kind of learn a little bit about dinosaurs or something.
I also go to the same medical school Sarah goes to. I agree that like the social justice is one of the big draws to BUSM. It's one of the I feel like it's one of the schools that really puts its money where its mouth is, like quite literally. Like for example, like one of the things that plague Boston area specifically, and I think many other cities in America, is public transportation isn't readily available to poorer neighborhoods, because public transportation itself actually causes the neighborhood prices to rise. And so what BMC does is it actually pays for Uber fares for people to come to get care and for them to get back home and stuff like that. So if they don't have a family member who is free to take them to a colonoscopy, like they have a way to solve that. And if they don't have the time to take their kids to like certain things, like we have a way to solve that. And not only that, like it's one of the, I think out of the many hospitals, it's one of the few hospitals that has its own food pantry, that has its own cooking classes, so that people can come and learn about healthy eating, because that's one of the major things that affect people of different socioeconomic status. It even has programs to help do taxes for people, because some people of a certain income, they get tax credits, but it's very difficult for them to understand a tax code. I mean, even for people like you and I who are college educated people, like doing taxes is quite complicated. And so BMC really does put its money where its mouth is, and it does all these things across the board. It not only looks at people and thinks about how do we get them the right medication, it also thinks about how do we prevent disease, like how do we get people to their appointments, how do we help people eat more healthy, how do we put money back into people who need it the most, so that they can make decisions in their life that help them be healthier and also help their children be healthier as well.
Yeah, I think for Michigan, I would say something similar to what I said for like why I chose medicine. I think for me, it was I broke down the things that were most important to me, like my values. I actually made like a Excel sheet of all the med schools I applied to, and like my values were the columns. Like one was like how far is it from where my family lives, just as an example. Other ones were like cost, things like that. Things that were available in the area, and then like educational programs. Like I was thinking I want to do an MBA at some point, and I was looking for schools that had that. So yeah, really think about the things that are most important to you. I think I could have ended up at any school that was close to my family because that's what was important to me. But I was happy to be at Michigan for that reason, as well as especially the 1 year preclinical. I think I have learned more in the last like 4 months of clinical year than I did all throughout the first, like, I don't know, 16 months of preclinical year. And I would not have learned, I think, any more in another year of preclinical. It's just amazing how much more you learn from seeing a patient who has a condition and like figuring out on your own, like, okay, what do I want to do for this person? So yeah, I think that's an amazing thing. I think Michigan also just has everything. It's a huge university, so if you're interested in something else, you can probably do some like research in literary fields while going to medical school if you really wanted to, and that's amazing to me. And I think people do kind of take use of that while they're here. But yeah, I guess I break it down to just like what's important to you. Really think about that and take that into account when you're picking schools.
So obviously I haven't started Icahn yet, but things that I do really like about it so far and I have visited are that I ended up choosing to go with the FlexMed program because I felt like Icahn School of Medicine really valued allowing their medical students to have a life outside of medicine. They don't want you to miss your your brother's wedding, or if you have to go to a funeral, they don't want you to feel like you have to miss that just because you're a medical student. And I think just obviously the best example of that is FlexMed. And I think they just really value you being a happy person. And I think they realize that that makes you a better medical student. Also, the location is great. It's right in Manhattan, which I think is really exciting. If I had to change one thing about my career path up to this point, though, is I would not have majored in biology, probably. I realized this the other day when I was thinking about how I was having cold feet about medical school. I don't like research is also what I've learned. And I think I ended up choosing biology because I thought that it was a good thing to major in because you're pre-med, or like if you wanted to be pre-med. And I wish I had been a little bit more bold and courageous and chosen like a language to major in, or something that I found like really engaging. Not that I dislike bio, but I felt like at this point, like it's med school or bust. Like I don't want to be a researcher. So I would just say like it's good to have backups. Like if it's good to be pre-med, it's good to like plan ahead and do your volunteering early. But also you should major in something that you find fascinating, and don't just do it. Don't just do things because you think you should for pre-med.
Awesome. Thank you guys so much. Moving on to, I think this should be the last theme, which is just tips and advice. So any one of these questions, feel free to pick one of them. We are going to ask you guys about if you could tell your high school, your college self one piece of advice, what would you tell them? A lot of you guys have already touched on this, talking about what kinds of experiences outside of your path have been meaningful for you, from being an EMT to beekeeping, to doing work with the American Heart Association and working in a GI clinic. And if you guys have any advice for balancing schoolwork and extracurriculars while maintaining mental health, I think this is a really big one, especially during COVID. A lot of people are stressed out and are wondering how to stay motivated. So any one of you guys can take one of these questions.
I would maybe say, like, for the first question, if I could tell my high school and college self anything, I would just tell them to enjoy what you have right now, because I think, and you'll get this told to you many different times down the road, and it'll get annoying, but I figure I'll just introduce it now, is that like you have the most amount of time now to pursue whatever it is that you want to do, and your time to do that will only get smaller and smaller and smaller. Even like first year medical school, you get told by fourth year students, oh my gosh, you like first year, you have the most amount of time. You are so lucky. And then in that first year, you don't feel like you have a lot of time. And then you get to second year and then you get to third year. And then now I'm the one who's a third year telling the first years that you have the most amount of time now out of all the years that you're going to have. And so I think it's important and especially in undergrad now, you have the most amount of freedom compared to medical school, and then medical school, you have the most amount of freedom compared to residency, and et cetera, et cetera. So I think I would have loved, like I think everybody else said, to enjoy life more, as opposed to focusing so much on like getting into medical school, getting good grades, doing these extracurriculars, all this other stuff. While that's still very important, I think it's also really important to enjoy the moment that you have, and because it'll just get less and less. You'll just have less and less time as you actually start working towards what you think is your dream and whatnot. So yeah, that would be it.
Yeah, I definitely agree with that. You get less and less time, but I think like in terms of answering these questions, I think that, the common theme that I tell people is that you just have to explore a lot. Like really, that's just number one thing. Because if you don't know what you're getting yourself into, you might become miserable later because you didn't know what you get yourself into. So I think just like, if there's one thing I want people to take away, is that you should explore a lot inside of medicine and outside of medicine.
I would definitely agree with Enoch and Sara on those points, especially pertaining to the last one. I think the way that I stay motivated and maintain my mental health is just do the things that make you happy. Like I started a quilt business where I buy and sell vintage and antique quilts. I did that my sophomore year during COVID, and I started it because I love antiquing and I love quilts. And my friends tell me because I'm a Capricorn, I like to monetize my hobbies. And so whenever I'm stressed, I just go out and I antique shop. And that honestly has become one of my most meaningful college experiences. And that's something that like got brought up in my interviews and that people really commented on when I was applying to FlexMed. And I think that just ties into Sara and Enoch's point, which is like, do what makes you happy, because you have less and less time. And if you don't take advantage of it, it's just going to slip away from you.
Yeah, I agree with all of these points. I guess the only thing I would say is the advice I give to myself, it would be that it's all going to be okay. Like you make one mistake, you get rejected from something, that's okay. Like that wasn't the thing you were meant to do, or that mistake helped you learn a lot, so you're going to do better in the future. I really there's so many points that are so anxiety provoking and like so much angst in this whole process, that just remembering that it's all going to be okay, and that like if you consistently work towards the things that you enjoy, it's going to be okay. And I think remembering that is such a big part of this process, and like making it through this really, really long and frustrating process.
Thank you guys so much. Okay, I'm so happy we were able to end this off on a positive note and a very uplifting note for all of you guys. So thank you so much, Sara, Enoch, Capriana, and Cameron. So we are now going to move into the live Q&A portion of our panel. And I'm also going to have their emails listed here. So you can copy them down, and feel free to reach out to any of them with more personal questions, or reach out to Take On college to sign up for our mentorship program. And you can also check out a medicine cabinet. They have great blog posts, and they also have great advice to share with you guys. So with that being said, if you guys have any questions now that you'd like our wonderful panelists to answer, please feel free to either unmute yourself or drop them in the chat, and we can get started with having them answer some questions. Yes, Katrina?
Hi guys, I just want to say thank you for taking the times out of your busy schedules to talk to us today. My question is towards, I think most of the panelists were major in neuroscience, which is something I actually just got into, so I'm very excited about it. My question is, do you think that was helpful in your now almost medical profession, or is there a reason why you chose that major over others?
I think, are you majoring in UW's neuroscience?
I am, yes.
Yeah, UW's neuroscience is particularly useful. I think that like it's taught in conjunction with the medical school. And so actually UW's neuroscience is basically the like medical school course, except it's extended into 2 years rather than like a month. And so like, I think Sarah and I both shared a sentiment. It was much easier to take the medical school courses of neuroscience after taking UW neuroscience course. Additionally, the neuroscience had a lot of like clinical relevance, and it was easy to see how you can translate the science to clinical medicine. And so like taking the UW neuroscience course was just like a very good way of seeing how you can apply the information you learn into clinical medicine, and as well as information you learn is actually the information you'll need to learn in medical school. So it saves a lot of time.
Also agreed. I really love the program, and I think it teaches you a lot about like the human anatomy, or like the anatomy of the brain, and then also helps you visualize the more abstract concepts of the neurons, which is really useful just as a skill to apply to medical school when you're like imagining tiny little cells as well. So I loved it, and I think it's a very nice small cohort that you get to move along with. So I'm excited for that adventure for you.
I'll just like hit on neuroscience really quickly because it was Michigan neuroscience was different than these, but yeah, I took it because I was excited about it, like interested in it. I think like learning how we think is such an amazing thing, especially learning how we learn was a really cool thing to me. So taking classes on that was like specifically interesting. Also, a ton of the classes overlap with like the pre-med classes you have to take. So practically, it also makes sense. But we should move on to the next questions.
Awesome. So the next question I see is from, I hope I'm not going to mispronounce his name, Sara. She asks, or he asks, would you mind comparing neuroscience with physiology? I don't know if any of you guys took physiology courses or were physiology minors or majors.
I can speak a little bit to that. I took a few physiology courses, and my other major was in molecular biology, so somewhat a little bit close. And I thought that the neuroscience dove really deep into the nervous system, like the brain and the central and the spinal cord, which I thought was in some ways narrow, but in other ways it really let you explore like a single not a single organ, but a nervous system, and it really allowed you to like dive deep into it. I think physiology is very useful because that's what you're going to be studying in medical school. And so I did take some anatomy and physiology courses when I was in college, just so that I could at least have a little bit of a baseline for like what a kidney was, and what kind of organs you're seeing other than the brain and the spinal cord and whatnot. So I think both have its unique advantages and also disadvantages, where you're missing out on some of the more unique things about neurons versus you're missing out on some of the more broad concepts of the human body.
Awesome. Thank you so much. All right. So the next question is from Julia, and she asks what a day in the life of a medical student is like. So Cameron, Sarah, and Enoch, do you guys want to take this one?
Sure. I mean, it really depends on the year you're in. So for example, if you're in first and second year at BU, they're mostly preclinical years. So that basically means you're just taking a lot of classes and studying all day. Each of the classes basically go through a system, so like the cardiac system or like the pulmonary system. And it typically span around like 2 to 4 weeks. So the first and second year is a lot of studying, but it also has a lot of free time because in medical school, nobody really expects you to go to class. Like even before COVID, we had this large auditorium that could seat 200 people, so a little bit more than our class size. And most of the professors say by the end of week 3, there'd be 2 to 3 people at most in the auditorium. And most of the time, they know they're just there to talk to the camera, and everybody's gonna watch it on recording later, or not even watch it, just read the slides. So first, second year is a lot of like studying / a lot of free time based on how you manage it. Third and fourth year, which is the years we're in right now, is a lot of going into work and kind of like working as a student, which functions, it depends on what the people trust you with. So for example, like when I was on surgery rotation, there's a lot of suturing, different wounds, and some small operative tasks. When I was in like the clinics, like I would see the patient by myself, interview them, do the physical exam, come up with my own diagnoses, and I'd discuss it with the attending before we go and discuss it together with a patient. And so it's a lot more like clinical based, a lot more like what will you do as an MD, so like as an intern or resident, and kind of like practicing those skills. And so basically there's the preclinical years, every school has a preclinical years where you have to study, and then the clinical years where you have to practice what you study.
Okay.
Oh, sorry. Go
Go
ahead.
ahead, Sarah.
Oh no, I guess I was just going to quickly add, every rotation is really different, depending on, like, I think the first 2 years are very similar in that you're like kind of studying, and you're learning a lot of material, just like you're in lecture all day, not all day, but like you're studying a lot of material and you're learning a lot of new concepts. And then in rotation, it's like surgery, the hours are crazy. You're getting into the hospital super early in the morning and you're leaving super late at night. And then other rotations, like my psychiatry rotation was amazing and I loved it. And I, went in at 9 and got out at 5, like, so I think in third year, your life really starts to like either really switch it up, depending on what rotation you're on. And you start to, get really good at sleeping in the car or on the bus or something like that. And then I've heard fourth year is supposed to be far more relaxed because after you submit your applications to residency, you're kind of just chilling and you're just kind of waiting for decisions to come back. So first 2 years are like study, and then third year is like a complete whirlwind, and then fourth year is more relaxed. So I would say that's like that maybe summarizes the day in a medical school. I don't know, Cameron, if you have any thoughts about that as well.
No, I totally agree. I just think there's so much variability, like rotation based, like which attending you're working with based. They could trust you a lot, or they could just have had a previous bad experience, or just in general, they don't like let med students do a lot. And that's kind of the attending, how they operate. So it really depends on so much. You could be in a surgical rotation where like the surgeon you're working with doesn't let you touch anything. It makes you kind of step back from the table. You could have somebody who like lets you do a lot more suturing and like, be a lot more involved. The other thing I was gonna say is, your lifestyle changes so much. Psych today, I had outpatient appointments. So I like was sitting right here all day. And it started at like 9, and then like 3 of the appointments canceled. So I studied during that time. But like I work 6 days a week, and it was like 12 hours on average, like up to 14 to 16 hours sometimes. And that was very different. So you just kind of have to roll with the punches and really like learn where you can and learn when you can. And that's kind of the life of a med student, I guess.
Awesome. Well, I think that's all the questions in the chat. Again, feel free to reach out to all the panelists individually. If you didn't get the chance to jot down their emails, no worries.